Hello, today we are going to know about routes of drug administration. Routes of drug administrations are mainly two types, enteral and parenteral. There are three types of enteral drug administrations like oral, sublingual and rectal. Parenteral drug administration are also three types. Number 1, injections. Number 2, inhalational. And number 3, topical. Firstly, we will discuss about oral route. It's most commonly employed. Drugs are administered for local and systemic effects. It has some advantages like number 1, most convenient, safe, painless and economical. Number 2, self-administration is possible. Number 3, drugs need not be highly purified. Number 4, higher concentration can be achieved for. It also has some disadvantage like slowly absorbed. Number 2, not useful in unconsciousness, vomiting, diarrhea and uncooperative patients. Number 3, irritant drugs and drugs which are either inactivated or not absorbed extensively in gut and liver cannot be administered. Number 4, pH of the gut, presence of blood or drugs in the gut, motility of the gut interfere with the absorptions and thus after bioavailability of the drug. Number 5, drug must be palatable to taste. Next we are discussing about sublingual route. The drug is placed under the tongue. The drug is absorbed by highly vascular buccal mucosa and transported directly into systemic circulation. Number 3, drugs administered by these routes are number 1, glycerol trinitrate, isosorbide trinitrate. In case of angina pectoris. Number 2, nifedipine drop. In case of hypertensive emergencies. Number 3, ergotamine tartrate. In case of migraine. Sublingual routes have some advantages like rapid onset of action. Number 2, self-administration is possible. Number 3, degradation in gut and liver can be bypassed. Number 4, remaining drug can be discarded after desired effect achieved. It also has some disadvantages like irritant and distasteful drug cannot be administered. Number 2, frequent use may cause ulceration locally. Number 3, excessive salivation may lead to swallowing of drug. Number 4, not suitable for children. Next, we are discussing about rectal route. Enema suppositories, ointments, glucose solution as rectal drip are administered for local and systemic effects. Now, what is enema? It is liquid preparation containing medicinal ingredient meant for rectal administration. Types of enema includes evacuant enema, like soap water enema used for evacuation of bowel before any operation or radiological examination. Acts by mechanical stimulation of rectal reflex. Next, diagnostic enema, like barium sulfate enema for radiological examinations. Next, retention enema, like prednisolone enema in ulcerative colitis. Next, what are suppositories? Solid conical bodies containing medical ingredient for rectal administration. Rectal route has some advantages like used in patients with nausea, vomiting and unconscious patients. Can bypass the first pass metabolism. For local effect, higher concentration of the drug can be achieved. But it also has some disadvantages like absorption is irregular and unreliable for systemic effects, may cause irritation and inflammation in rectal mucosa. Self-administration may not be possible, needs privacy, special skill and embarrassment to the patients. Next is intravenous route. Drugs in aqueous solution are administered by this route. Advantages: emergency condition, drugs in large volumes can be given to provide total parental nutrition. For transfusion of blood and blood products. Disadvantages: strict asepsis, special instruments, skills are required. Spread of diseases like AIDS and hepatitis B may occur. Insoluble drugs like suspensions, oily drugs cannot be administered. Close monitoring is required to achieve maximum benefit. Next is intramuscular route. Drugs administered directly to the muscle. Both soluble and insoluble drugs can be injected in deltoid or gluteal muscles. Depot preparations like procaine penicillin G, benzathine penicillin G can be given. Next is subcutaneous route. Non-irritant drugs can be administered by this route. Drugs like adrenaline, insulin, local anesthetics. Low-dose heparin, saline in pediatric practice are injected by this route. Not soluble in shock stage because reduced peripheral circulation decreases the rate of absorption. Next is intra-articular route. Drugs are administered directly into the joints. Higher concentration of drug is achieved in the joint. Needs strict aseptic conditions. Examples include number 1, hydrocortisone acetate, number 2, triamcinolone hexaacetonide, number 3, dexamethasone acetate. Next is inhalation route. Drugs are usually inhaled for local and systemic effects are number 1, anesthetics, number 2, oxygen, number 3, salbutamol, number 4, terbutaline, number 5, budesonide. And advantages are quick onset of action, minimum systematic side effects, and self-administration is possible. Disadvantages are special type of apparatus required, may cause bronchial irritation. Inhalation steroids may lead to oral candidiasis. Next is topical application. Drugs administered directly to skin for systematic effects. Examples are 2% nitroglycerin ointment and scopolamine. Drugs are available as powders, ointments and solutions, sometimes also applied on mucous membrane for local effects. So, we are at the end of this video. Thank you for watching. All the best and don't forget to subscribe.